Hi, I'm Brant Houston. I'm the night chair of investigative reporting here at the College of Media at the University of Illinois, Urbana-Champaign. Today, I'll be talking about investigative reporting and some projects that I've been working with students on over the summer, particularly on COVID-19. Well, at the university, I do a number of things. One is I teach a course in investigative reporting, I teach a course in public affairs reporting, and occasionally a course in data journalism. I also oversee a news site called cu-citizanaccess.org, which is a newsroom, online newsroom we run out the journalism department. And it's a place that any student can publish on. They get professional editing and guidance. And sometimes the stories are used over Illinois public media, and sometimes they're distributed to other news organizations around the country. But most of the time, we do stories that really dig into issues. For example, when COVID came along, we did a survey of all the jails, county jails in Illinois, to try to figure out how many people were getting sick, but particularly looking at the lack of isolation cells for inmates. And we've done things on nursing homes. And then this summer, we spent a lot of time, of course, looking at COVID issues and had a major project that got national notice. And that was on the definition of recovered. You see these numbers about people who've recovered from COVID-19. In fact, the definitions are all over the place in Illinois. If you haven't died within 42 days of your diagnosis, you are considered recovered. And we did a survey of all 50 states and 2 territories to show the inconsistencies and really how little that word means during this virus. I think we are more data driven than other places. That's part of my background. So you'll see a lot more data visualizations than you might see in others, but that's what we always do. We're always trying to make more complex systems understandable and to get to the root of a problem. So I think we've done that. One other thing I would add with our COVID coverage is we have been dealing with numbers that are often inconsistent or don't match up with other numbers when it comes to infections and rates and so forth. For example, the county, because it wants to confirm cases, always has a lower number than the state, and with very few exceptions. And if you then try to match up with the university dashboard, that's not going to match up that well because there's a different timeline there. And so we're trying to help people understand what's really happening and how bad the situation is and how it has improved. We're really trying to ramp up CU citizen access over the next few months because of the reductions that have been made at staff at News Gazette, the cutbacks that will probably continue to happen across media in this area, in this region. And I think that we have an obligation as a public institution to try and make sure that information stays out there, that news stories are done, and that people can be informed. After all, it's really at the root of having a vibrant democracy. If you don't know what's going on or you don't know what your government's doing, you really have trouble making decisions during elections or deciding whether to contact a representative. So people really need the information. It's kind of been disappearing, and I'm hoping we can help to fill some of that gap.